Hello friends, I am Dr. Vijay Prakash and today I will be talking to you about basics of complete denture prosthodontics. Now, when we talk about a complete denture patient, we often see in a clinical practice that we see a patient who has lost all his upper and lower teeth, and we call such a patient as completely edentulous. As we know that loss of teeth in a patient can cause psychological, aesthetic and functional impairment, and there is always a need to restore and replace the missing teeth and adjacent structures with artificial substitute to allow the patient to function and lead a normal life. Now, replacement of these teeth and adjacent structures is covered under a specialized branch of complete denture prosthodontics. So by definition, if we see what is complete denture prosthodontics, it is defined as that body of knowledge and skills which pertains to restoration of the edentulous arch with the removable dental processes. And if we talk about complete denture prosthetics, then by definition it is the replacement of natural teeth in the arch and the associated part by artificial substitute. Similarly, a complete denture can also be defined as a removable dental processes that replaces the entire dentition associated structures of the maxilla or mandible. Now, what are the objectives of complete denture prosthodontics? Now, first thing is whenever a patient loses teeth, then definitely, as I told in the beginning, that the function, aesthetics and psychology, all these, there is an impairment of that and there is a need to restore this. So the first objective is to enable the patient to masticate food so as to get adequate nutrition. Secondly is to restore aesthetics by preserving the normal appearance and close to a natural look which the patient can appreciate. Thirdly, to restore speech as distinctly as the breathing factors permit. And fourthly, to provide oral comfort and improve the patient's sense of well-being. Next is to educate the patient about the changes to be expected in the supporting tissues, because the patient will not be knowing that the dentures may need relining after a certain period of time and there will be resorption of the bone. So all these things we need to educate the patient, a complete denture patient. Next is also to convince them about the need for regular checkups and subsequent treatment. So all these are objective of a complete denture treatment. Now let's see what are the components of complete dentures. There are 3 surfaces of a complete denture and there are 4 parts of a complete denture. Now let us see each of them one by one. First, the denture surface. This is called as the impression surface, also called as the intaglio surface, as this surface is in direct contact with the basal seat tissues and the limiting structures. So we can call it as a negative replica of the tissue surface of the jaw. By definition, if we see, it is a portion of the denture surface that has its contour which has been determined by the impression. Now this is the way in which we will be making an impression, and which you see on the denture, this is the negative replica of the tissues. Also, which we need to see, this surface should be free of any voids or there should be any acrylic blebs on the surface of this. If there is any, you should trim that, because that will injure the mucosa, the gentle mucosa. Second surface is the polished surface, which you see all around. This is the polished surface of the denture, and this is also called as the CAMEO surface. By definition, if we see, it is that portion of the surface of the denture which extends in an occlusal direction from the border of the denture, and it includes the palatal surface. It is that part of the denture base that is usually polished, and it includes the buccal and a lingual surface of the teeth, which we can see. So polished surface also includes the buccal surface and the lingual surface of the dentures. So this surface includes the labial surface, the buccal surface, the lingual surface and the palatal surface. This is the palatal surface. As we told in the definition also, this surface should be highly polished, and that is the reason it is called as the polished surface. This is to facilitate plaque control. This is very important. The next surface is the occlusal surface. Now, occlusal surface by definition is a surface of a posterior tooth or occlusal rims that is intended to make a contact with the opposing occlusal surface. So this which you see all around is the occlusal surface of the denture. As we can see, this surface consists of denture teeth, which simulates the natural teeth and cusp and acts as a sluiceways to help in masticatory function. Next is the parts of complete dentures. Now there are essentially 4 parts of complete denture. You have the denture base, which you can see here. This is the denture base. You have the denture flange, which is here. You have the denture borders and the denture teeth. Let us see each of them one by one. First, the denture base. Now by definition, denture base is that part of the denture that rests on the foundation tissues and to which teeth are attached. So if you can see here, this is the denture base and you see the teeth which are attached to the processes. Now it is that part of the denture which rests directly over the oral tissues, as we have just seen in the definition, and to which teeth are attached, which help in restoring the natural appearance of the patient. Now purpose of a denture base is to transmit the forces which acts on the dentures to the basal seed tissues. Wider the denture base, more the retention and lesser are the forces on the underlying tissues. So one thing which we have to keep in mind is we have to extend the surface. The greater the surface area of the denture base, better it is, because lesser force will be there on the underlying tissues. Secondly, it forms the foundation of the entire denture, and also this area can be characterized for increasing the aesthetics. So denture base can be made up of acrylic resins. Mostly it is made up of acrylic resin. They can be metal based denture base also. Some of the most commonly used metals are gold and gold alloys, type 4 type cobalt chromium alloys, and nickel chromium alloys can be used for making metal based denture. As I told, acrylic denture base are the most commonly used material to construct denture bases. Why? Because they are easy to fabricate and they are economical. Secondly, the very big advantage is they can be relined and rebased very easily. They can be characterized to increase the aesthetics, and they have adequate rigidity to resist the functional forces. But the drawbacks of this material is they cannot be used in thin sections, especially in cases where the interarch space is very less. So in those cases, it is difficult to use acrylic resins because they require adequate thickness. Because if you don't give adequate thickness to the denture base, there are all chances that it will fracture. Second drawback is that the wearing of acrylic denture base is much faster when you compare it with a metal denture base. And thirdly, thermal conductivity is less, and also there are chances of acrylic warpage or distortion. Now next type of denture base material is, as I told you, are metal denture bases. Now metallic denture bases by definition, if we see, are the metallic portion of the denture base forming a part or the entire basal surface of the denture. It serves as a base for the attachment of resin portion of the denture base and the teeth. And the most commonly used metal for denture base types, as we mentioned before also, they are type 4 gold alloys, cast chrome based alloys, aluminum based alloys, and also nickel chromium alloys. There are obvious advantages of using metal denture bases because they have high strength, because rigidity is great because of high modulus of elasticity, and they have increased accuracy because you have a direct contact of metal surface with the tissues, and there are less chances of tissue change under the metal base, lesser porosity, and because of the casting, the flow of the metal, and therefore because of the high polishability that it is easy to clean. They have better thermal conductivity. That is one of the bigger advantages over acrylic denture bases, which because of this greater thermal conductivity, it provides increased sensory input to taste of hot and cold food. Another thing is there are less chances of deformation under function because of high rigidity. The drawback, however, are high cost because there is an additional procedure. You have to do fabrication of metal denture bases. And then another very big disadvantage is this type of processes is very difficult to reline or rebase, and fabrication is time consuming and also technique sensitive. Part of complete denture is the denture flange. It is defined as that part of the denture base that extends from the cervical end of the teeth to the denture border. That is, if you can see here, the cervical end of the denture teeth to the denture border. So this entire area is the denture flange. So in the upper denture, if we see, the denture flange include the labial surface and the buccal surface. And in the lower, if you see, you have the labial flange, the buccal flange, and the lingual flange. This is the lingual flange. The labial flange provides the lip support, lip fullness, and aesthetics. And if the labial flange is too thick, it will give an artificial look to the denture. The patient will never be comfortable. If this area is too thick, then the patient will have kind of a ballooning face, and the patient will never be comfortable making functions or during speech. Also, the labial flange has a V-shaped notch in the center, which is to allow the accommodation of labial frenum, which is a passive frenum, and that is the reason this notch is given in the labial flange. Next is the buccal flange, which provides support to the cheeks, and they occupy the buccal vestibule of the mouth. In the lower denture, if you see, the buccal flange, they transfer the occlusal forces to the buccal shelf region. Now, why this region? Because this is the primary stress bearing areas in the lower arch. And here, if we see, you have the buccal frenum, which is attached here, which is having active muscle fibers, and therefore we should provide additional relief in this region here. Next is the lingual flange, which occupies the space which is adjacent to the tongue, and this is the alveolingual sulcus, if you see all around, and this is the lingual flange. So this is the area which is adjacent to the tongue. It contacts the floor of the mouth and provides the peripheral seal to aid in retention of the denture. So if we have overextended lingual flange, that may result in loss of retention of the denture. Also, if we have overextended portion of this denture, then the patient will complain of difficulty in swallowing or pain on swallowing. Now, next part of the denture is the denture border. This portion is the denture border. By definition, it is the margin of the denture base at the junction of the polished surface and the impression surface. It is the peripheral border of the denture base at the facial, lingual, and the posterior portion. And this part of the denture provides the peripheral seal, which aids in the retention and stability of the denture. Because if we have overextended or underextended denture borders, that will result in loss of retention. And another thing which we need to keep in mind is the denture border should always be smooth and well polished, because if these areas are not smooth or well polished, then there will be denture irritation, there will be mucosal irritation, which may cause soft tissue injury to the tissues, and any sharp margins will irritate, and as I told you, will irritate the underlying soft tissues, and that is the reason they should be well rounded and well polished. Next part of the denture is the denture teeth. Now, denture teeth form the occlusal surface of the denture. As you can see, this is the denture teeth. They are the occlusal surface of the denture, and they provide aesthetics. They enable the patient to chew, and they help in speech. They are usually made up of acrylic, or they can be also made up of porcelain. So on the basis of the tooth morphology, we can classify denture teeth as follows. They can be anatomic teeth. Now if we see anatomic teeth, they are making an angulation of 33 degrees. So this type which is having an angle, which is having this edge making an angle of 33 degrees is called as the anatomic teeth. They can be semi-anatomic teeth where they are making an angle of 20 degrees, and they can be non-anatomic, which are also called as 0-degree teeth. Next, on the basis of the type of material, the denture teeth can also be classified on the basis of the type of material. That is, they can be acrylic teeth or porcelain teeth. They can also have gold occlusals on the surface, or acrylic resins with amalgam stops, acrylic teeth with metal inserts, or they can be interpenetrating polymer network resin teeth, which is commonly called as IPN resin teeth. As I told you that the most commonly used teeth in fabricating dentures are the acrylic teeth. Why acrylic teeth? Because they are easy to fabricate, the characterization is possible, they have superior aesthetics, they can be easily repaired and adjusted, and they can be used with metal base by the design of nail head or retention loops of diagonal spurs. Another thing is they can be easily retained with the acrylic denture bases chemically, and that is very big advantage over porcelain teeth, which are retained mechanically. However, they have a number of drawbacks. They have low wear resistance. The chances of loss of vertical dimension because of this is high, and the teeth cannot be rebased as such. They tend to stain. There is another drawback of acrylic teeth, and also shape and form cannot be maintained on trimming. Next, we have the porcelain teeth. The porcelain teeth, they have hardness and abrasion resistance, which is very good in comparison to the acrylic teeth. They have good, excellent aesthetics. As I told you, they can maintain vertical dimension for long periods. They are resistant to staining, and shape and form can be maintained during trimming, which is the drawback. Here it is the advantage of porcelain teeth. However, what the drawbacks of porcelain teeth are, they have poor fracture resistance. They are mechanically retained to acrylic denture bases with retentive pins. That is one big drawback of porcelain teeth. So we have to create these retention pins. We have to make diatoric holes on the surface of the porcelain teeth so that acrylic resin can mechanically lock into those holes, and they can be mechanically retained with the help of retention pins. So this is one drawback of porcelain teeth. Another thing is they can, because they have a very high wear resistance, they have a tendency of extensively wearing the opposing natural enamel. So another drawback, very big drawback of porcelain teeth. Another type of teeth which can be used are the gold occlusals. Gold is considered the best material to oppose natural dentation, natural enamel, and the drawback here is they are very expensive and they require a longer fabrication time, and that is the reason they are not that popular. Apart from this, you have acrylic resin with amalgam stops. So basically, we will restore it with amalgam. These occlusal surface, we'll place amalgam in, we'll make amalgam stops here and place amalgam in this. Why amalgam? Because they will be having a superior strength. They'll be having better wear resistance in comparison to acrylic resin, and they are simple and they are less expensive than the gold occlusals. So you can also use acrylic resin with amalgam stops. Apart from this, metal inserts can also be used. You just create a hole here. You can place those Vitalium metal inserts so that they have a better wear resistance than acrylic resin, especially in the posterior teeth. Apart from this, IPN resin is also used for fabricating acrylic, for fabricating the denture teeth. They have the advantage of both the acrylic and porcelain teeth. This material is basically unfilled, highly cross-linked polymer chains, and that is the reason they have a better strength than your regular acrylic teeth, and they are having a greater wear resistance, and also they are better material when you say there you have opposing say porcelain teeth are there. So in those cases, if you use this type of denture teeth, they will be much more advantageous. So this is all about the basic of complete denture prosthodontics. We'll stop here. Thank you for watching the video.